Today is our fifth session on 60 Paishu transporting point. Okay, I hope you are enjoying the knowledge. Let's start our session. Last session, day before yesterday, we discussed about the in-spring point. We started discussing in-spring point. So, day before yesterday, we discussed about the ST44 in-spring point. And today we are going to discuss in-spring point bladder 66, urinary bladder 66. So let us see the session location of the bladder 66. So what is the bladder 66? This is the horary point of the bladder meridians. Friends, do you know what is the horary point? So horary point means it is the same element point. So bladder meridian is the water meridian. Okay, its element is the water, and bladder 66 is the water point of the water meridian. Okay, so we says it is the horary point, and this is also in-spring point. In-spring point, there are the Paishu transporting point on each meridian. There are the 12 meridian, and each meridian have the 5 transporting point. So there are the 60 transporting point. So our bladder 66 is the one of that point. It's a in-spring point. Okay, bladder 67 is the Jingwell point, and the bladder 66 is the in-spring point. Okay, so location of this bladder 67, the bladder 66. Okay, at the lateral border of the foot. So lateral border toward the little toe, lateral border of the foot in the depression distal to the metatarsophalangeal joint. Okay, so you can see this is the depression distal to the metatarsophalangeal joint of the little toe. Okay, so you can see a video also. So I am showing you video how to locate this point. See how to insert the needle here. Okay, this was about the bladder 66 location. Friends, what is the bladder 66 point category according to TCM? So bladder 66 is the in-spring point. This is the water point of the bladder channel. This is the horary point of the bladder channel. And function of the in-spring point, general theory. So what is the function? It's clear heat from the channel. Treat changes in the complexion. Okay, when there is the complexion, changes in the complexion. Okay, so that this point treat changes in the complexion, treat febrile disease also. When there is the febrile disease, when there is a fever, this point is useful. Help in the clearing stagnation at the channel level. When there is the stagnation at the channel level, it helps. Secondly, bladder 66 move chi and the blood in the channel. Reduce excess state of the organ channel. Organ in level of the channel. Okay? For the young channel, like the bladder, young spring point, in spring point, specially clear channel heat, because always when it is young channel, okay, this is the water point. So water put up the fire. So this point clear the channel heat, okay, fire and the stagnation affecting the head, face, and local channel pathway. Now, action of the bladder 66 as per TCM. So, number one, this point clear heat from the bladder channel. Bladder 66 clear, the channel heat affecting the head, excess heat causing agitation. Secondly, heat leading to redness, pain along the bladder channel, and useful for red and painful eye, because bladder 66, bladder meridian start from the inner canthus of the eyes. Okay, so it red and painful it treat red and painful eyes and headache behind the eyes or the occiput. Heat disturbing the shin. When heat is increased, our shin is disturbed. Secondly, calm the mind. This bladder 66 calm down the mind when heat is increased. I told you when increase, then mind is disturbed. So shin is disturbed. So by pouring the water on the fire, on the heat, it's calm the mind, because heat rising in the bladder channel may disturb the heart plus mind. So bladder 66. So reduces irritability. This when any person is getting irritating. Okay, this bladder 66 reduce irritability, calm agitation, calm the agitation, and help with the restlessness or anxiety due to channel heat. Other Other work of the bladder 66, it benefits the head and the sensory organ. How the bladder channel dominates head, brain, eyes, neck, upper back, and bladder 66 reduces the distending headache along the bladder channel when headache is there on the bladder channel pathway. Okay, it's reduce the headache, occipital headache also, eye redness, swelling, pain, and tension radiating upward food along the channel. Secondly, activate the channel and elevate pain. Useful for pain along the lateral leg. When pain is on the lateral leg, okay? In case of sciatica, that is a UB sciatica, UB type sciatica, bladder type sciatica, okay? This point work. Pain in the foot, heel and sole, and pain following the bladder meridian pathway, when pain on the bladder meridian pathway, this point works. Stiffness or muscle spasm due to channel stagnation. Friends, take a notebook and pen along with you so you can take the important notes what I am talking. Then other benefits, other work of the bladder 66. This point clear damp heat in the lower limb of the channel, lower limb portion of the channel, and though not as the strong as Hesse point for organ damp heat, bladder 66 help heat and damp stagnating along the external channel. Burning pain along the bladder channel and the swelling of the foot. So, what is the indication from TCM clinical approach? Number one, headache and sense organ symptoms. Head and sense organ symptoms. Occipital headache. Then headache extending to the eyes. Okay, behind the eyes, there is the headache. Okay, eye pain, swelling, redness, blur vision, tearing from the heat. When tearing, there are the tearing, watering eyes. Okay, from the heat. And number two, local symptoms, swelling of the foot, pain at the metatarsophalangeal region, and numbness, tingling due to chi stagnation. Number three, mental and emotional symptoms related to heat crossing to the heart shell through channel connection. So irritability, anxiety, restlessness, and agitation. Number four, channel pain. Pain of the foot, especially lateral side. Difficult walking due to channel obstruction. Heel pain, okay? Leg pain along the pathway of the bladder channel. So, what the technique you will use for using the bladder 66? Okay, sedation and tonification as per TCM. So, needling method, perpendicular or slide obliquely. Needle this point perpendicular or slide obliquely. 0.2 to 0.3 tune. Only little insertion enough. So, and tonification when using bladder 66 to move stagnant chi without strong clearing, insert on exhalation. Okay, so when you are using bladder 66 to move stagnant chi, so insert on exhalation. Okay, when ask patient to exhale and insert and manipulate lightly clockwise and it's clockwise and remove needle on exhalation. Inhalation, sorry. Remove needle on inhalation. And sedation technique when treating channel heat. When the heat in the channel, okay, so insert on inhalation. Ask patient to inhale and insert the needle. And counterclockwise, slow manipulation. Yes, yes, Dipti. Okay. So remove on exhalation. Secondly, when the treating channel hit, okay, insert on inhalation and remove on the exhalation. So what is the combination with the bladder 66? Okay, we can use the combination with the other point on the different disorder. For bladder channel heat rising to the head, pattern, this is pattern. Okay, write down bladder channel heat rising to the head. Okay, use point bladder 66 plus bladder 2 plus GB2 plus Li4. Again repeating bladder 66, bladder 2, GB2, gallbladder 20, sorry, gallbladder 20, GB20 and Li4. Secondly, for red painful eyes due to heat, red and painful eyes due to heat. When there is the heat, you have to see it. Okay, this is the excess condition. Heat is the excess condition, so you have to see the point. Then for red painful eyes due to heat, bladder 66 and Taiyang extra point, Taiyang point, and plus liver 2 and gallbladder 37. Again repeating bladder 66, Taiyang plus liver 2 plus gallbladder 37. 37. Next pattern for occipital headache. Headache on the backside, occipital headache. Bladder 66. This is the proven protocol that I am giving you. Okay, for occipital headache, bladder 66 plus bladder 60 plus gallbladder 20. Again repeating occipital headache, bladder 66, bladder 60 plus gallbladder 20. Next pattern for calming the mind due to heat. When there is the heat, okay, so mind is disturbed, Shane is disturbed. So we want to calm down it. Okay, so use point bladder 66 along with the heart 7 and DU24. Bladder 66, heart 7 and DU24. Next pattern for foot pain along the bladder channel, okay, along the bladder meridian, foot pain. So bladder 66, bladder 65 and bladder 64. Bladder 66, bladder 65 and bladder 64, foot pain along the bladder channel. Now let us discuss the function. So when the with the action of the bladder 66. So while this is the in-spring point, this bladder 66 clear heat. Okay, so strong in-spring point So reduce heat in the channel, head and the eyes. Then secondly, calm the mind. So moderately strong. So this point from the heat. Benefit head and eye. Very effective for bladder channel headache. When headache on the pathway of the bladder channel. Okay. So it is very effective for the bladder channel headache and the eye pain. Eye pain on the inner side, inner canthus eye pain. Okay. This point is very effective. Move channel chi. This point move channel chi as relieve pain along the bladder meridian. And local effect, this point treat foot swelling and pain. Okay, so let us discuss the complete TCM style clinical protocol guide for bladder cystitis. This is the in-spring point and water point of the bladder channel. Again, I am repeating. Bladder cystitis primarily clear the heat from the bladder channel, calm the shame, and descend the rebellious chi. Okay, what is rebellious? It is a contraction of the chi. It's descend the rebellious chi. So function TCM style, clear heat from the bladder channel, clear head, eyes, nose, channel connection, calm the shame, and descend chi, especially rebellious chi from the head. Okay, benefit back because bladder channel are going through back. Okay, benefit the back, lumbar, and the leg pain due to channel imbalance. And this point is best for the heat in the bladder channel because this is the water point. Also headache and occipital vertex. Eye disorder from heat and irritability, mania and agitation. Urinary heat symptoms. Okay, when there is the heat during the urination. Okay, so this point also treat that symptoms. So bladder damp heat, urinary tract infection. That is the cystitis. So pattern is the damp heat obstructing the bladder. When damp heat is the obstructing the bladder, so bladder damp heat, the urinary tract infection, UTI. Symptoms are burning urination, frequent and urgent urination, dark scanty urination, suprapubic discomfort, and fever irritability. So in this case, if you see the tongue, so tongue will be yellow and sticky coat, yellow sticky coat on the tongue, and pulse will be slippery and rapid. So in this pattern, disease pattern, acupuncture protocol, bladder 66, clear bladder channel heat, write down. Bladder 28, this is the bladder back shoe point. Then REN 3, this is the front view point of the bladder. REN 3, CV3, front view point of the bladder. Bladder collapse, that is the difference, that is the spleen chi sinking. When spleen chi sinking is there, there will be prolapse of organ. So this is the main patterns of any prolapse of the organs. Okay, so that we will discuss when we are discussing the spleen. Okay, then SP9. SP9 it is the empirical point for the draining the dampness. Then bladder 22 is used for the water passages. And kidney 10 is the cool lower jaw heat. And principle for using this protocol, clear damp heat from the bladder and promote urination. Second protocol, second pattern, disease pattern, it is the acute urinary burning with the heat type dysuria. Heat type dysuria. So symptoms are burning, urination, sharp lower abdominal pain, and yellow urine. Okay, acute urinary burning with the heat type dysuria. In case of dysuria, burning urination, sharp lower abdominal pain, and yellow urine. So in this case, we can use the protocol bladder 66, clear channel heat, and bladder 40, cool blood and clear heat. Spleen 6, SP6, regulate urination because this is the connecting of the 3-inch channel. This point is the connector of the 3-inch channel. UB63, this is the Ziegler point for the acute pain. Okay, when there is a pain on the bladder organ or the bladder meridian along with the bladder meridian. Okay, use the Ziegler. So our principal heat and relieve acute urinary pain. Next pattern is the occipital vertex headaches from the bladder channel heat or wind heat. Okay, occipital vertex headache from the bladder channel on the bladder channel. Okay, so symptoms are the occipital headache, stiff neck, sensation of heat in the head, light sensitivity, and if you see the tongue, in this case, tongue will be slightly red tip of the tongue will be red and thin yellow coat. Okay, yellow coat, always remember yellow coat shows the heat. When see the yellow coat on the tongue, okay, blindly identify there is a heat in the body. Okay, and pulse will be floating and rapid. In this pattern, you can use the protocol UB66, bladder 66, clear head heat via channel, and bladder 10 for the, this is for a very dangerous point. You have to use very carefully this point. Okay, so not deep needling. Okay, this point is used for the occipital local point. And gallbladder 20. This is the wind point. Okay, so to remove the wind, we are using the gallbladder 20. So LI4, so open, yangming, and governing channel. Bladder 60, expel wind, benefit head. And Taiyang for local relief. Using this protocol, our principle to clear heat from the bladder channel, expel wind, and relieve headache. Next pattern, red, painful, swollen eye, that is the bladder channel heat. So ST44 is used for the stomach eye. Okay, ST44, this point used for the stomach eye, and bladder 66 for the bladder channel eyes. Okay, when the heat from the stomach, we are using ST44. When there is the heat from the bladder, we are using bladder 66. And symptoms for this pattern: red eye, burning sensation, photophobia. And photophobia means we are not tolerating any light in front of us. So we like in stay in the dark. Okay, that is the photophobia. So tearing eyes, and for this pattern, our protocol is bladder 66 main point, UB1, UB2. These are the UB1 is the dangerous point. Use carefully. If you are not confirm you are not skilled, then use UB1 on the dual meridian on the hand. UB1 and UB2 to local eye point. And gallbladder 20, clear wind heat. LI11, this is the systemic heat. This point is the LI11. It is the homeostatic point using to balance the heat. And liver 2 cools the liver fire, affecting the eyes. So we are using this protocol for principal clear heat from the bladder channel and the upper orifice. So number 5, mental restlessness, agitation. So this pattern, you have to write down: mental restlessness, agitation, mania. That what mania because of heat disturbing the shade. So in-spring point strongly calm the shade when heat rises. And symptoms are mental agitation, shouting. Okay, when patient always. Sorry, disturbance because of bad network. Okay, am I audible now? Okay. So mental restlessness, agitation, mania, heat disturbing shen. Okay. So in spring point strongly calm the shen when heat rise. And symptoms are mental agitations, restlessness, and mania or shouting behavior. And insomnia. When you see the tongue is red with the yellow coat, and pulse is the rapid and the wild. For this pattern, we are using protocol bladder 66 to clear heat, heart and bladder channel heat, and heart 7 This is the empirical point for the calm the shin and pericardium C1 subdue fire. Okay, it's reduce the fire because the pericardium is the coverage of the heart, envelope of the heart. And DU20 settle yang. So DU20 settle yang. And liver 3 regulate chi. Kidney 1 descent yang. When yang is right, apply kidney 1. It is a very important point for the descent to yang. So we are using this protocol for principal, clear heat, calm the shin, and anchor yang. Number 6, lumbar pain, back pain due to bladder channel, heat in the bladder channel or the chi stagnation. Symptoms are burning or hot sensation in the lumbar area. Okay, shake the lumbar area while you are the hand touching like this. Shake, so you will feel the hot sensation in the lumbar area. Pain along the UB meridian, UB channels, and pain is worse with the heat and better with the cold pack. When somebody apply heat fermentation, okay, so pain will be worse and better with the cold pack. For this pattern, we are using protocol bladder 66, cool the channel, bladder 60, distal for lumbar pain, bladder 60, okay, distal point, and UB 40, bladder 40, that acute back issue. When there is a back pain is acute, apply bladder 40. And bladder 23, tonify kidney if chronic. And GB 34 is the insertion point for the tendons, or muscles and tendons. Okay. And for principal, we are using this protocol, disperse channel heat, relax tendons, and relieve the pain. Insomnia. Next disease pattern, insomnia due to bladder channel heat disturbing heart. Bladder channel heat disturbing the heart. So always seen when heat rises from the kidney, bladder to heart. Kidney heat rising from kidney or bladder to heart. Okay, there will be insomnia due to bladder channel. This is called heat disturbing heart. Symptoms are difficulty falling asleep. पेशेंट करवटे बदलते रहेगा. ओके, थोड़ा थोड़ा हिंदी बात कर रहा हूं मैं. पेशेंट करवटे बदलते रहेगा. डिफिकल्टी फॉलिंग asleep, restlessness, irritability, and dark scanty urine. Okay, ask patient, so what is your color of the urination? Okay, so scanty urination. Urination will be not forcefully. Okay, urination will be scanty. So protocol, bladder 66, calm the shin and the clear heat, heart 7, pericardium 6, kidney 1. So this kidney 1 descent chi, and bladder 15. This is the heart back shoe point. You have to sedate all point. So we are using this protocol for the principal, clear heat plus calm the shin plus anchor the heart chi. Number 8, flank pain, rib side pain from the bladder channels, disharmony. Okay, use when pain follows UB channel lateral line. UB channel, UB channel have the two line on the back. One one line is the 1.5 chun lateral from the midline, and second line is the 3 chun lateral from the midline. Okay, so this lateral line pain we are that is the indication, and symptoms are pain along the rib or the flank, distension and channel tenderness. Protocol: bladder 66, clear heat in the channel, and bladder 58. This is a levo connecting point of the channel disorder. And liver 14, it is the special point for the rib pain. And gallbladder 34, this is the inflation point for the sinews and tendons. And principle of using this protocol: clear heat, regulate channel chi, and ease pain. Number 9, sciatica, UB channel type. Sciatica on the pathway of the UB channel. Back side, okay? Back of the leg, sciatica. UB channel sciatica. Symptoms: pain radiating from the buttock and posterior leg, buttock and the posterior leg, and running down to the posterior leg. That is the burning nature, follows UB channel pathway. And protocol for this sciatica, UB sciatica: bladder 66, this clear heat on the stagnation in the channel, then bladder 40, bladder 60, bladder 57, and GB 30. Okay, long needle we are using. And we, sciatica, okay, where the sciatica, use the contralateral side, lingu and dabai, master tongue point. It is the for the better result. Lingu and dabai. So principle of using this point: activate bladder channel, clear heat, and the stop pain. Number 10, allergic rhinitis and blocked nose. This is UV channel involvement. Allergic rhinitis and blocked nose when UV channel is involved. Symptoms are nasal congestion and sneezing, clear or yellow mucus depending on the heat. Head congestion is there. When you find yellow color, where the mucus that node secretion is yellow, tongue is yellow, identify there is the heat. Okay, UB66, that clear head, nose orifice, and Li4 and GB20, bladder 12, it is for the wind, and DU23 and LU7. Principle of using this point: open the nose and clear heat and wind, regulate lung chi. Next pattern of the disease pattern: food disorder. That pain, swelling, numbness, it is the local disorder. Food disorder: pain, swelling, numbness on the UB channel, especially dorsal foot and the fifth toe, little toe. So symptoms are the heat or the swelling on the lateral foot, pain on the toe region, difficult walking. Patient is getting difficulty in the walking. For this pattern, we are using protocol: bladder 66. This is the primary point. We have to see it because this is a heat pattern. UB65. Okay, this is the source point. So source point UB65, pain relief. Okay, all source points balancing full meridian. Okay, so this is UB65 the source point. This is the pain relief UB64 yawn point. Okay, then bladder 60 relax tendon. Principle of using this point: clear local heat and reduce swelling and open channel. So UB66 clinical application. So in condition of the damp heat in UTI, urinary tract infection. So what will be bladder 66 action? So this point clear the channel heat and benefit urination. Next condition, urinary burning. In case of urinary burning, so bladder 66 action is the heat reduction. Third condition is the red eye. When there is a red eye, the bladder 66 action is the clear upper orifice. Fourth condition, insomnia and mania. Bladder 66 action is the calm the shade and the clear the heat. Fifth condition, lumbar pain. So bladder 66 action is the clear heat from the channel. Sciatica. In case of lumbar pain, see the tongue of the patient when there is the yellow coating on the bladder area of the tongue. Okay, so it is the lumbar pain due to heat. Okay, seeded this bladder 66, clear heat from the channel. Then sciatica pain due to heat. This is the then action on the sciatica of the bladder 66. This is the distal point to the open the UB pathway, sciatica on the bladder pathway. Occipital headache. Okay, condition is the occipital headache. So action of the bladder 66, open the bladder meridian to the head. Okay, how you like the session? So those who are not yet on my WhatsApp group, so I am sharing the link here in the chat box. You can join my WhatsApp group with this link. Link is on the WhatsApp chat box. You can join my WhatsApp group or message me on my WhatsApp. Now I allow you to unmute yourself.
So, namaste, sir.
Namaste, Miraji.
Sir, can you show me the demo for how to sedate UB66?
You insert the needle against the pathway of the meridian.
Okay, sir. Thank you.
Against the pathway of the meridian. Insert the needle against the pathway of the meridian. Okay, bladder meridian comes from the upside to the down,
Yes, sir.
ending at the tip of the toe, little toe.
Yeah.
Okay,
But it's a little difficult, no, sir?
it is not difficult. It is very easy.
Okay, sir.
Okay. It is. I shown you the location. Okay, and again I am putting the image of location in the group.
Okay, sir.
Mhm.
Thank you.
Sir, please tell the food disorder protocol, sir. Food disorder.
Food disorder
Difficulty in
protocol
walking.
when there is the disorder along with the bladder meridian.
Yeah.
Okay, use
Foot is foot having crack.
bladder 66, bladder 65, and bladder 64.
Okay.
Bladder 66, bladder 65, and bladder 64.
Okay.
Cracked heel
Cracked.
in winters, what we should do?
Again, sorry.
The cracked heel, heels are cracked in winter.
Crack heel.
Yes, sir.
Crack heel that is the heat, because of heat.
So again, sedation.
It's sedation.
UB66 is enough, sir.
Yeah, UB66.
Thank you. You can use magnet also, no, sir?
You can use magnet also, but if you are using needle action, that result will be comes quick.
Fast. Okay.
Hello, sir. Good evening.
Good evening.
Sir, you have told about pain along the bladder channel. But if there is tingling numbness along the bladder channel, then also this point will be useful.
Tingling numbness,
numbness.
that is the neurological problem.
Yes.
Tingling numbness, but also it is when we are looking on the vertebral problem, when there is
Yes. Compression, nerve compression.
nerve compression in the vertebra. Okay, that also tingling and numbness bladder channel. So we have to check the reason. So we have to
There is
check the
nerve compression.
nerve compression. We have to check the needle. So you can use GB34 also. In this case, we can use GB31 also, along with the. Okay, so we have to strengthen the when there is the numbness. Numbness is the what is it is the deficient pattern.
Okay.
It is the deficient pattern.
Okay. Numbness along with pain is there.
Pain. Pain is the excess and numbness is the deficient.
Okay, but the patient can have both also, no?
Okay. So if there is the both, you have to what is the excess there? What is the important? What thing patient getting irritated? It is the numbness or the pain. Then you first select the pain or the numbness.
Okay.
Bilateral or unilateral, sir? Needling bilateral, both UB66?
Bilateral, you can use the bilateral. Then you can use the contralateral also. You can use the UB, that is the Taiyang family, UB and ASI. Use my Dr. Tan balance balance method.
Okay.
Manjari, you can use na.
Yes.
Yes, sir. Yes, sir.
Hmm. So, what therapy we are using? It is our. You can use the common sense. Okay, you can use the master tongue point, uh, lingo and dabai on the contralateral side. That also work. Okay,
Okay, sir. Thank you.
so enough for today.
Okay, sir.
Anyone have any queries और किसको कुछ पूछना है? अंजलि रत्नपारखी जी.
हेलो.
हाँ, यस.
हाँ, ये 80 साल की उम्र का लेडी है, मगर
हाँ,
उनका पैर का 80 साल का उम्र का 80 years.
आपका 80 साल का
80
लेडी है.
years उम्र है.
80 साल का.
हाँ. हेलो.
हाँ, बोलिए. हाँ, बोलिए.
उम्र है 80 years. तो
हम्म.
अभी मैंने पैर में स्ट्रेंथ नहीं मिल रहा है उनको. मैंने घुटने में भी दर्द है, मैंने पैर में
हाँ,
स्ट्रेंथ नहीं मिल रहा है आपकी.
हाँ, ये
तो
न्यूरोलॉजिकल प्रॉब्लम है. अभी अभी पेशेंट मेरे सामने नहीं है. उस
हाँ हाँ
पेशेंट, हाँ, तो ऐसे कंडीशन में नहीं नहीं कुछ बोल नहीं सकते ना मैं. एक्चुअली क्या प्रॉब्लम है? सो
हाँ.
पैटर्न आइडेंटिफिकेशन इम्पोर्टेंट.
हम्म.
पैटर्न
थोड़ा
क्या
बहुत.
है?
हाँ, पैटर्न क्या है मतलब उम्र हो गया है, अभी पैर में तो स्ट्रेन नहीं है, उम्र होने से जो भी होता है जनरली है
नहीं,
कि.
नहीं, उम्र होने से आपको मालूम है. 80 इयर्स. मैंने
हाँ.
मैंने एक पेशेंट देखा है. एज ऑफ 98.
हम्म.
He was paralysis.
हम्म.
I done treatment. Within 15
हम्म.
days, he's
हम्म.
now he's walking throughout the village.
हाँ.
Okay, so
हाँ.
age is not matter.
हाँ. तो इसलिए अब थोड़ा बहुत ये आप जो आज सिखाया है इसके माने इस कोई प्रोटोकॉल है कुछ, उम्र हो गया है इसके लिए कुछ प्रोटोकॉल है.
प्रोटोकॉल प्रोटोकॉल कैसे? पैटर्न समझना पड़ेगा. पैटर्न से
हम्म.
प्रोटोकॉल आता है.
हम्म.
पेशेंट
हम्म.
मैंने पेशेंट देखा ही नहीं है, तो मैं आपको
हम्म.
प्रोटोकॉल कैसे बताऊं?
अच्छा.
हाँ, पेशेंट से कंसल्ट करना पड़ेगा. कंसल्टेशन लगेगा.
हम्म.
हाँ, तो अब मैं ऐसे कुछ भी प्रोटोकॉल बताऊं, आपने यूज किया, रिजल्ट नहीं आया. बाद में
हम्म.
मुझे बाद में वही बोले सर ने बराबर प्रोटोकॉल नहीं दिया.
हम्म.
है कि नहीं? तो ऐसा ऐसा
वो तो
कोई
सही है
ऐसा ब्लाइंड प्रोटोकॉल काम नहीं करता है.
ना. आप इतना देर तक तो जो बता रहे थे ऐसा ऐसा पैर में न्यूरोलॉजिकल प्रॉब्लम होने से होगा, कमर में दर्द है, साइटिक
हाँ,
नर्व का.
ये
हाँ
पैटर्न है. वो हीट पैटर्न है. तो उनमें
हाँ हाँ.
उनमें कौन सा पैटर्न है? कौन सा पैटर्न?
हम्म.
अभी अभी यूबी ब्लैडर 66 इज वर्किंग फॉर
हम्म.
द हीट पैटर्न. ओके,
हम्म.
तो
हाँ.
उनके बारे में उनका क्या पैटर्न है?
अच्छा. हाँ.
वो समझना पड़ेगा ना.
हम्म. वो तो सही बात है.
ओके.
उनके गर्मी भी लगता है, माने ब्लड वॉमिटिंग भी हुआ था कि माने
हाँ,
गैस्ट्रिक अल्सर है.
एक काम कीजिए. कल कल
हम्म.
मुझे कल मेरे से
हम्म.
उनका मुलाकात करा के दीजिए. मैं
अच्छा.
आपको हाँ प्रॉपर प्रोटोकॉल में बताऊंगा.
अच्छा.
उनका
अच्छा.
उनका उनका टंग टंग भेजिए. टंग का फोटो भेजिए. उनका क्या
अच्छा.
रिपोर्ट है? पैथोलॉजिकल रिपोर्ट है क्या?
रिपोर्ट
मतलब
रिपोर्ट नहीं, रिपोर्ट नहीं कराया. रिपोर्ट नहीं करा, टांग में काला भाव था कि अभी एक ट्रीटमेंट करा रहा हूँ कि
हाँ,
दूसरे एक आदमी से, तो उसमें काला भाव चला गया कि जो
टंग
टांग में जो
टंग
काला भाव था.
हाँ, हाँ, टंग का फोटो दे दीजिए। काला
अच्छा
टंग अगर
हाँ
काला पड़ता है तो वो बहुत वर्स्ट, एकदम वर्स्ट इनडिफिशियंसी रहता है।
हाँ 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 हाँ।
हाँ हाँ
अभी थोड़ा सा प्रोटोकॉल लगाया वो थोड़ा सा ठीक है यार की, मगर पैर में मैंने
हाँ
मैंने जोर नहीं मिल रहा है यार की, इसलिए
हाँ,
आपको।
ठीक है। आप टंग का पिक्चर भेजिए।
अच्छा 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 अच्छा
हाँ हाँ।
अच्छा। उसके बाद बात करेंगे, अब नहीं जानने से कैसे बोलेंगे आप भी।
वही ना, मैं पेशेंट को देखा ही नहीं
हाँ
देखा।
हाँ वो तो सही बात है, वो सही बात है।
हाँ तो हाँ।
ठीक है, कल एक बार टांग एक बार दिखा दूंगा कि आपको ये करके।
ओके
ओके।
ओके ओके।
थैंक यू सर, थैंक यू सर।
हेलो सर। हेलो।
हाँ हाँ, बोलिए कोकिला जी।
हाँ हाँ, नमस्ते सर। नमस्ते
नमस्ते।
सर। थैंक यू फॉर शेयरिंग वेरी इंफॉर्मेटिव सेशन सर। हमारा एक क्वेश्चन है, लाइक स्वेलिंग अराउंड द आईज है सर, स्वेलिंग एक्चुअली दिस बैग्स आर देयर अंडर द आईज ना, ऊपर भी
हम्म।
स्वेलिंग है सर, आई का ऊपर भी थोड़ा स्वेलिंग है।
अच्छा, तो
हाँ सर।
वो स्वेलिंग आता है, वो बिकॉज ऑफ स्प्लीन भी आता है, बिकॉज ऑफ किडनी भी आता है। ओके, बिकॉज ऑफ ट्रिपल वार्मर।
हाँ हाँ सर। ओके।
हाँ, टंग देखना पड़ेगा, टंग देखना पड़ेगा। तो मैं
ओके सर।
बता पाऊंगा। हाँ, टंग
ओ
देखना पड़ेगा।
ओके सर। थैंक यू सो मच सर।
ओके ओके ओके। ओके।
हेलो सर।
हाँ बोलिए।
हाँ सर, क्लास बहुत अच्छा था आपका आज।
हाँ
काफी कुछ
हाँ।
सीखने के लिए नया भी था। सर, पर मुझे ना जीबी टाइप स्टैटिक का है।
जीबी टाइप साइटिका है।
हाँ जी।
हाँ, तो जीबी टाइप साइटिका है, तो आपका बर्निंग सेंसेशन है क्या?
सर, हमेशा नहीं होता, कभी कभी ऐसा होता है वो।
लेकिन जब भी होता है तब बर्निंग होता है क्या?
हाँ
बर्निंग
जी, हाँ।
सेंसेशन आता है क्या? हीट
हाँ
हीट
जी।
रहता है क्या, कोल्ड रहता है?
हीट रहता है, बहुत ज्यादा पेन होता है उसमें, हीट आती है।
हाँ हाँ। तो एक काम करो, आप GB 34 लगाओ, GB 41 लगाओ, जो
हाँ जी।
साइड। हाँ, GB 34, GB 41, और UB 66 सिलेक्ट करो।
ओके
ओके।
सर।
हाँ,
हाँ जी।
और कॉन्ट्रालेटरल साइड, अपोजिट साइड में लिंगू और दबाई।
ओके।
हाँ, निडल लगाना चाहिए, मैग्नेट नहीं।
ओके सर।
हाँ।
ठीक है। थैंक यू सर।
ओके ओके। थैंक यू। एंडिंग द सेशन।